Have you ever had a chest cold and all of a sudden you get this sharp pain in your chest that feels a lot like a heart attack? Or as a nurse, have you ever taken care of a patient where it hurts them so much to take a deep breath in? Well, today we'll talk about a cause of chest pain known as pericarditis. We'll talk about the causes, symptoms, diagnosis, and treatment of this condition from an emergency room perspective. So your heart rests inside of your chest, inside a sac called the pericardium. This sac has 2 layers, and there is a small amount of fluid found between the layers. When this sac becomes inflamed, you get pericarditis. So how does the sac become inflamed anyways? Great question. There are 2 groups of causes, infectious and non-infectious. Of the infectious causes, viruses are by far the most common. And frequently, these are the viruses that cause things like chest colds or pneumonia. Bacterial and fungal infections can also cause pericarditis, but these occur less commonly. Non-infectious causes include things like cancer, lupus, rheumatoid arthritis, trauma to the chest, a recent heart attack, and even certain medications, especially biologics and anti-cancer drugs. Please note that there are also many cases of pericarditis termed idiopathic, which means we don't know what's causing it. So how do you know you have pericarditis? Well, the classic symptom is chest pain, but it's not just any chest pain. Typically the pain is central, it worsens when you take a deep breath, and it's positional, which means if you sit up or lean forward, the pain will get better or go away. Sometimes the chest pain can radiate back to the trapezius muscle. Now there are a plethora of things that can cause chest pain, so we need to make sure that we rule out any life-threatening issues before settling on the diagnosis of pericarditis. As healthcare providers, we need to make sure the patient's not having a heart attack, an aortic dissection, a pulmonary embolus, pneumonia, or any other number of things that can cause chest pain. Now there are a few things that can help lead us to the correct diagnosis. First, we always need to make sure that we get a good history and examine the patient. Assess the patient's chest pain, asking whether it is positional or increases with a deep breath. Another common finding is this thing we call a pericardial friction rub. So if you take your stethoscope and you put it on a patient with pericarditis, specifically on the left side of the sternum or the left sternal border, you may hear this scratchy sound, which some people describe as sandpaper on wood. Oddly specific, right? It's often heard better on inhalation or a forced exhalation, where the patient forces themselves to take a deep breath out, and they do that while they're leaning forward. Because the patient is having chest pain, we'll want to get an EKG. Now, EKG findings with pericarditis can be frightening, especially if it's the first time that you're seeing them. You'll typically see this widespread ST elevation, and your heart will drop to your stomach, and you'll freak out internally because you think the patient is having a STEMI, and you know that's one of those really bad heart attacks. And then when you see that the ST elevation is in most of the leads and not just certain sections like an MI, and you correlate this with the patient's other symptoms, your heart will come back to your chest and you'll be able to take a deep breath. Now, obviously, we'll leave the EKG interpretation up to the physicians, but widespread ST elevation is associated with pericarditis. Now, there are certain lab and imaging tests that can be done to help differentiate pericarditis from other causes of chest pain. You'll want to draw blood work and specifically inflammatory markers like a CRP, ESR, or white blood cell count, and all these will be elevated. You'll also want to draw a troponin to help differentiate pericarditis from MI or heart attack. Now, the catch-22 is that a troponin can be elevated with pericarditis. We'll get a chest x-ray to look for enlargement of the heart or fluid on the lungs. An echocardiogram, which is basically an ultrasound of the heart, can look at how the heart is contracting and also if there's any fluid around it. A CT scan can be performed and can show inflammation of the pericardium. Now, one thing that can happen with pericarditis is a buildup of fluid in the pericardial space, which we call a pericardial effusion. Now, this doesn't have to be an issue, or depending on how much fluid builds up, it can be a major issue. Because too much fluid in the pericardial space puts pressure on the heart, and then the heart cannot fill with blood and contract normally, and that's an emergency. Most people with pericarditis only require oral medications to get better, but the treatment largely depends on the underlying cause and if there are any complications. If a bacterial infection is causing pericarditis, the patient will need antibiotics. If the cause is a virus or other non-infectious cause, and the pericarditis is mild without complications, the goal is pain control and supportive care. Typically, medications like ibuprofen or aspirin, which are both anti-inflammatories and pain relievers, are given because pericarditis is an inflammatory process. Sometimes providers will prescribe steroids or a medication called colchicine to help with the inflammation. And there's actually a whole algorithm on treating pericarditis that I will link below because I don't want to bore you with it. But the bottom line is that most patients get to go home and to follow up with their doctor in about a week. It's the patients who are high risk or have other complications that have to stay in the hospital and get admitted. And then one other important treatment recommendation, whether the patient goes home or stays in the hospital, is to avoid strenuous physical activity and promote rest until symptoms resolve. If you want me to make a certain video, post that in a comment down below. For more emergency room videos, click the link over here. And don't forget to subscribe so you never miss another post.